A very rapidly developing part of medicine is neurosurgery. The goal is to restore the use of one's limbs who has had trauma or for whatever reason loses the use of their limbs. Dr. Justin Brown is a board certified neurosurgeon and pioneer in reconstructive neurosurgery. He joins us in the studio today on The Truth. Dr. Brown, thank you.
Thanks for having me.
You bet. So how long have you been a neurosurgeon?
Well, started residency in 2001, finished in 2007, and then we do a fellowship in 2008. So I've been in practice since 2008.
So when you're in the forest, it's sometimes hard to see the trees, but are you aware of the rapid advancement in these areas, or does it just seem kind of a natural progression to you?
No, definitely aware of it's really been an emphasis shift in recent years. There's always been an interest in, restoring function. But early in our career, there was only a few options, and now the options seem to be sort of blossoming.
So when you see a patient who's is it usually the result of trauma that people lose their motor activities in their limbs?
Well, yeah, trauma
is that what we're talking about?
Trauma is the most common one I see, but of course, strokes, leave people half the body not working well. I see a number of following surgical procedures done by other specialties where a nerve is injured and they develop a foot drop, or the fingers don't extend, or specific nerves that are injured as a result of other operations. But trauma is the most common cause.
Surgery might be the most difficult to handle, given that it was at the hand of someone that should have known better, I'm thinking, or is that just part of the risk?
It is part of the risk. It's something on the consent forms. Every time somebody's operating on a limb, they'll say there's nearby nerves that could be injured in this operation. Now, it's usually a very small percentage, less than 5% of people would have that kind of an outcome. But when it happens,
that's a small percentage, unless you're in the 5%.
That's right. So coming from Boston, I would see sciatic nerves that were severely injured from hip replacements. But each time I'd see them was the first time that surgeon had ever had that problem. But I get them from the entire New England region, so to me, it's a common problem.
So after 26 years of practice, is there a particular trauma that you see more than others? Is there any commonality from injuries that you're able to point to?
Well, I think people survive severe injuries better now than they did 20, 30, 40, 50 years ago because of better airbags and safety in cars and this sort of thing. But surviving often means we have more people living with permanent disability.
But auto accidents would be the number one?
Auto accidents are number one. And of those auto accidents, still motorcycles, ATVs, snowmobiles, these sorts of things are probably the more common source of a lot of these injuries.
So what you're trying to say, it sounds like the more fun the vehicle, the higher the risk.
It's probably about right.
Because I can tell you it's fun to ride a motorcycle.
Yeah.
And snowmobiles are way fun. But you see those injuries a lot.
I do, yes.
And they talk about with strokes that you've got a critical hour or half hour to get treatment, and you can really mitigate a lot of the damage that would come. Is there a magical moment in trauma that is analogous to strokes?
There is. So, thinking about what structures it's being injured. So stroke, we've got a blockage where blood's not getting to the brain. And within a certain window, that brain is, sort of alive. And if you restore the blood flow, you can recover it. Beyond that window, that brain is going to die. With trauma, we've looked at compression on the spinal cord. If the spinal column is displaced and the cord is being compressed, if we relieve that compression earlier, we usually get more function back. With peripheral nerves, the same thing. If they're being crushed and we can relieve that pressure, it's more likely they'll make a natural recovery. So
what's a kind of general time frame that we're talking about? Is it minutes or an hour or?
It's hours. Typically.
Hours. Like how? 1 hour or 4?
Well, it's hard to do those clinical studies. So you look at things more like, within a week, within 72 hours, within 24 hours, and within 24 hours appears to be better.
Interesting.
But I'm sure earlier than that is even better.
So I have a friend who fell out of a deer stand, and he had a fake knee.
Okay.
But he landed on his good leg without the fake knee, and his doctor told him that if he had landed on the leg with the fake knee, that he more than likely would have spent the rest of his days in a wheelchair. Do you see many hunting related type accidents? I mean, I hear it seems like a lot of people fall out of deer stands or will have some sort of a traumatic injury while out in the wild.
I don't see as many of those. Mine are more recreational. Somebody diving into a shallow pool at a party or doing some sort of reckless behavior or simply auto accidents.
Well, diving into a shallow water, body surfing is exactly how James Shepard, a friend of mine, my late friend in Atlanta, was paralyzed and came home. His parents discovered that at that time, and this was in the 70s, that there really wasn't a good facility to take him to other than in Denver. And the logistics were pretty severe from Atlanta to Denver. So they got the notion that they would just start their own spinal center.
Yeah.
And today that was the genesis for the Shepherd Spinal Center in Atlanta, which I'm told is one, if not the premier facility in America for people with spinal injuries, at least.
Yeah, it's an excellent center.
You work with people that have had strokes as well.
I do.
And so tell us about that. How does blockage result in someone being able to lose functionality in their hands or arms or whatever?
Sure. Can I get technical?
I'm
gonna get technical.
I'm sure our audience will relate. I might struggle a little bit.
All right.
I'm from Macon, Georgia. I was kind of the bottom of my class in high school. I've caught up a little bit since then, but go for it. Let's see where we go.
So the genesis for movement is going to begin in the brain. We've got a premotor center and a motor center, and it's going to send the signal down to the spinal cord. And then the spinal cord itself is going to send that signal out through peripheral nerves to the muscles. So if you have a stroke and you eliminate the primary message center from above, I like to compare it to the old computers. Remember the old computers?
Sure.
That if you took a hammer and you hit the CPU, you'd get static on the screen. We get kind of the same thing up here. The CPU is up here, the screen being the motor output, you're going to get static. So what they get is the side of the brain that's injured, the opposite side of the body activates, but doesn't know how to activate properly because it's not getting signal from above. So they will often get tone, spasticity, the hand curls up, pronates, wrist flexes, it turns into their side, the leg goes straight, the foot goes down, the toes curl and turn in. And they may have some residual function in that limb, but they're severely impaired. So daily routines are stretching it out and wearing braces and going to physical therapy and trying to overcome this dysfunctional output that's no longer regulated by the brain. So our approach to that is, can I tailor that output to something that is functional? So when the foot goes down and in, I can trim back the nerves and decrease that excessive plantar flexion, or excessive inversion, get the foot flat so they can walk better again. When the arm is balled up like this, I can get rid of some of the elbow flexion, extend the elbow again. I can take a wrist flexor and make the fingers open. So there are things that we can do to use what's left over to create function that they have lost.
So is that in effect retraining the brain to some extent in layman's terms?
You're sort of making the best use of what's left over.
Gotcha.
And there's a lot of retraining there.
And PT is one of the tools in your tool bag?
PT is a big part of it.
Yeah. But you also do reconstructive surgery.
Correct.
So and by the way, you explained that even a boy from Macon, Georgia could understand. Right. That wasn't too technical.
Good.
I got it. That's a very good explanation. So what do you do in reconstructive neurosurgery?
So some of those were descriptions of reconstructive surgery. So that was taking the muscles that are hyperflexed and moving them so now they can extend or they can do a function that's more adaptive for the patient. So if the patient's stuck with his wrist in full flexion and fingers clenched tightly, we have a set of muscles that go to the first knuckle and a set of muscles that go to the second knuckle. We really only need the second one to close the hand. If they're both going with way too much action, we can take the first one and bring it to the back of the arm to get the wrist up. And so we can start using things that are active and repositioning them in a more functional position. So that's one type of reconstructive procedure. The other, and we have a video to talk about, is what's called nerve transfer. And this is really
Let's watch that video, Anthony. If you can play it, I'll ask Justin to narrate what we're seeing. There we go.
So we're demonstrating his hands close and open, his elbows flex, and his shoulders work. And then the type of injury we're going to see is the one you get frequently from falling from a motorcycle or snowmobiles we talked about before. So the upper nerve roots that go to the arm have been ripped out of the spinal cord. And so his
literally
hand,
ripped out
or just ripped in two. So his hand works perfectly fine. So now what we're going to do is go in. We need his elbow to flex. We're going to peel off the nerve to the elbow flexor. We're going to splice into the nerve that closes the fingers and flexes the wrist. And we're going to send some of the wires that were going to the hand to their new destination. And they grow like this. They grow a millimeter a day, and they work their way in, and they're going to reinnervate that muscle. They're going to connect to that muscle. And then the brain has to figure out now when we squeeze the hand closed, the biceps flexes. And so then with what we call neuroplasticity, the brain's going to reallocate that, and he's then going to learn that the hand can close without the biceps, and the biceps can work without the hand.
Amazing. You've short-circuited that circuit, that wire.
Right. That's right.
Which actually is a tendon?
It's a nerve. It's a nerve. Yeah. So we're taking the wires that had come out of the spinal cord that were going to the hand, and we said, no, we're gonna splice off of that and
reroute that.
We're gonna reroute that. So that procedure was absolutely
amazing.
Late 80s or 90s is when that one was very first done.
Who figured that one out?
Christophe Oberlin is an orthopedic surgeon from France.
Amazing.
Who did that particular procedure.
In hindsight, I'm not a doctor, but just watching the video, it kind of makes sense to me.
Right.
That you can borrow from one to activate the other.
That's right. And so this was previously only applied to nerve injuries. And so one of my pushes and other people across the world said, if this works in nerve injury, what about all the other paralyzing injuries where there are good nerves to pull from? And so that's how we've transformed spinal cord injury in the past couple of decades. So now you can take a man who's broken his neck and all he has control of is his shoulders and flexing at the elbows with no use of hands. And when he lies on his back, his arms will fall onto his face because he has no triceps. We can now say, what do we have redundancy of? Or what do we have two nerves doing the same function? And so with the elbow flexion, you have a biceps. Under that, you have a brachialis. And on the forearm, you have a brachioradialis. All three of them do one function. They flex the elbow.
I see.
So we say, all right, let's take the wires to one of those and let's send it down to the fingers to make the fingers close. And then the other thing the biceps does is rotate the hand up this way. There's another muscle called the supinator that rotates the hand up that way. And so we take the nerve from that supinator and put it into the finger opening. So now we've been able to take patients who were quadriplegic and essentially make them a functional paraplegic. And despite what they'll tell you in the news, the number one goal of patients with quadriplegia is not walking. It's independence by using their hands to feed themselves, to operate their phone, to operate their chair, to be able to take care of themselves independently. And hands make the biggest deal of
be on the
else.
Computer.
That's to use the computer as
Sure.
well. That's right.
So what do you think about Neuralink? Elon Musk concept of implanting a computer chip, I guess at the top of the spinal column or the base of the...
Well, on the cortex of the brain.
Yes.
Is where they're usually going for that. And I think it is a way to get the output from the brain. So what we need is signals. Like this one, we had the signal from the hand.
When you talk about signals,
yes.
What is it in the body? I mean, to turn on a light, you're sending a signal. You're actually connecting a signal
right.
to bring electricity to the light. What kind of a signal does the body? What does it use?
Well, we generate an electrical signal. So when you think I want to move my hand, remember the cortex of the brain. We got the premotor is going to plan how that's going to move, and it's send it to the motor area, which is going to send that down the spinal cord and turn on the pathway that closes the fingers. And so these are electrical circuits that are running along these axons that cause the muscle to depolarize and contract. So that's the signal. So we want then to say, hey, what if the limb was severed from it? Can we record off of the original signal? Can we record off the motor neuron in the brain, the primary motor neuron, and tell the limb that's what it wants to do? So that's the idea behind it. Now, when you look at the cortex, you have billions of neurons in there, and populations of neurons overlap each other. So you don't have discrete areas that says this is index finger, and that's middle finger, and that's small finger, and so forth. They all live together. So we have to have significant processors to listen to all the static coming off the surface of the brain and try to decode that into signals as what was the intent of this individual? How did he want to move the limb? And then we can try to use that then to activate the limb or a prosthesis.
So what is the computer chip that Musk is
Well, that's it.
working
That's
with?
going to be recording the information or the noise, almost like an EEG, electroencephalogram. So there's electrical activity that you can record off the surface of the brain, but it's pretty messy. So we have to take that and filter it down to get a signal that makes sense, that we can say, hey, can you think that? And we'll take that. Well, we got a good signal there when he tries to do this, and we're going to turn that into movement. So we're then going to make that to activate a muscle or activate an artificial limb.
Are spinal injuries and paralysis, are they on the rise, decline, or are they pretty static in terms of numbers?
I think they're pretty static. People are surviving much better now. We've got great care from places like Shepherd Center. People used to die of urinary tract infections or, bed sores or other secondary problems down the line. And they've gotten very good at teaching folks how to manage these things. And so people are living full, long lives now. So the population of people with spinal injuries has grown because folks survive now.
Gotcha.
But the incidence is probably fairly static.
Got it. We'll get right back to the show after this brief word from our sponsor, Masculine Man Essentials. Look, most deodorants on the shelf are full of aluminum, parabens, and synthetic junk. Masculine Man Essentials goes at it differently. All natural ingredients, built for men, and it actually holds up through the whole day long. Whether you're at the office, at the gym, in traffic, or just getting home for the night, try Masculine Man Essentials. I've been using it, and I can tell you, it's the real deal. Head to masculinemanessentials.com, grab yourself a 2-pack or a 4-pack, use the promo code TRUTH at the checkout to save on your first order, and the link is in today's show notes. As you know, we don't put our name on anything that we haven't tried and believe in. So when I tell you about Nessa's Hemp, I want you to listen up. Nessa's Hemp is a Chicago-based company that makes hemp, and it was founded by Anessa. And what she's built is really something. We're talking about clean, high-quality hemp products with no gimmicks, just real ingredients, real transparency, with real results. Whether you're dealing with stress, sleep issues, inflammation, or you just want to add something natural to your wellness routine, Nessa's Hemp has something to offer you. Head over to nessahemp.com, that's Nessas hemp.com, and check out what they've got. Use our promo code TRUTH for a discount just by being our listener. Roll tape.
Hear that chime? That's the chip waking up. Oh, here it goes, connecting.
Just like that, Lee Martin's wife, Lisa, activates the chip embedded in his brain.
And now I'm controlling the cursor.
That cursor that's moving,
Yeah,
that's just being controlled with your brain.
yep. Pretty wild, huh? I know it seems like science fiction, but here I am. And it works.
Do you draw any conclusion from that?
Yeah, so that's what he's doing, is recording signals off of the surface of the brain, and he has to get from that essentially 4 signals: up, down, right, and left, like playing a video game. And so he needs to try to turn on the signal that they've turned into moving the cursor up or moving it to the right or moving it to the left.
So intellectually, you're not practicing with Neuralink, but do you relate to this? Do you feel like it has promise?
I do think it has promise.
What has to happen for it to become a reality?
Well, Elon Musk is the right guy to do it because a lot of sophisticated technology. So reading off the surface of the brain, I like to tell people, is a little bit like reading the static off the back of your television and telling me what the picture shows. It takes a lot of processing to make that happen. I'm a little biased that the peripheral nerves are the natural output. The nerves that exit the spinal cord are the natural output of the nervous system.
Do you think it's possible that at some point we'll be able to use a computer to decode the brain?
Portions of it. Portions of the brain. The entire brain gets a little tricky, but they're, what are we seeing? What's visual processing look like? Or what is the intended motor plan? Or these sorts of things potentially.
So I know this is getting a little out there, but as I shared with you, I've volunteered in the mental health field for 30 years, and I've sat through a lot of presentations from very smart, knowledgeable people, including some of the top psychiatrists in America. I've drawn the conclusion that of the entire body, the brain is sort of like America when Christopher Columbus got here, that we know the least about the brain of any other organ in the body. Is that a fair statement?
That is a fair statement. You think about all of the non-aware functions of the brain. So I talk to people about this because if you recorded everything off the brain, you'd get so much stuff you'd be overwhelmed. When you're standing upright and you put your arm up in front of you, your brain has to calculate your current position, the weight of your arm, the shift of the rest of the body to counterbalance the weight of putting your arm out in front of you, anticipating the velocity of the arm going forward, when it's going to stop, and do all of that so that you can maintain balance and not fall over with all the different adjustments we do of our limbs throughout the day. There is so much unaware processing that takes place at all times that to say, all I want is to have the arm do this, well, we can do that, but you need to have all of the rest of the system of balance and anticipation and predicting weights and predicting reaches and velocities that all goes on inside the brain. If you saw all of that on a computer screen, it would be completely overwhelming.
Well, this might be a little far afield for a neurosurgeon, but, you know, I just philosophically, I mean, I looked at my 92-year-old mom. She was still reading. She was still learning.
Mm-hmm.
And it seems like that is a human condition that we have, that we just seem to have this natural desire to learn. Yet, she died at 92.
Yeah.
So even all the 92 years of learning that she did was lost. What if there was a way to capture that learning and share it? Now, there's some learning that we probably don't want to look at. But it just seems like such a loss that all those years, all that work just gone in a split second. And you're describing the brain in computer terms and electrical terms. It seems like that, you know, my fantasy of being able to read and record and preserve that knowledge could really help humanity.
Yeah, you would think. You think the movie Matrix?
You know, I should have watched it.
You got to watch it.
Sci-fi just never has really appealed to me. I should go watch it.
He would do the Matrix downloads, where in an instant he would download everything that they had to do with a particular topic. So he learned martial arts in a second, and so that's how you'd want to import all that, right? So
right.
He had 92 years of learning. We don't have 92 years to learn what she learned. So how do you get that information transmitted quickly?
Right, and then how do you disseminate it? And how do you separate the important stuff from the non-important, and how do you preserve someone's secrets without outing them, I guess? I don't know. But isn't that kind of what AI is doing?
In a way, yeah.
I mean, I am amazed. I will be conversing with Aura, especially early on, and my wife would walk into the room and she'd say, "Who are you talking to?" And I would say, "I'm talking to a computer." And she would respond, "Well, it sounds like you're talking to a female." I said, "Well, you want me to swap it and put a male's voice on? I can do that from the U.S. or Great Britain." I mean, it's really pretty funny, but I am amazed at how much you can learn from Grok or Claude and all the purposes that you can use it for.
There's a tremendous amount of information available at our fingertips now that didn't used to be there. The trickiest part about AI right now is, when is it telling the truth and when is it misinformation?
I couldn't agree more.
Because it's compelling every time. How eloquently it delivers the information makes it believable, and you almost don't want to question it.
Well, what about in medicine? Do you ever go to Grok to get medical questions answered?
I've gone to ChatGPT to look at it.
Okay, fair.
It'll direct you to the papers and so forth. Sometimes it misinterprets those papers, so you have to go in there and read them yourself. No, that's not what it said. It said something else.
Yeah, I've had those conversations with Grok, and I've backed Grok into a corner, and they've conceded that I'm right. And then I'll say, "Yeah, but next week I'm going to come on and ask you the same question, and you're going to give me the same answer you started with."
Right.
So what's that about?
Yep.
So, I probably have better things to do than arguing with Grok, but, I'm just wired that way, I guess. So where do you see us going from here? Well, before we do that, what about robots? Are you watching robots? My knee surgery was performed by Dr. Ahrens at Emory.
Okay.
And I think he did a fabulous job. After the surgery, when I went back for my first checkup, he revealed that he was assisted by the Mako robot.
Okay.
I said, well, where was that in the informed consent chat we had a couple of weeks ago? But anyway, that's a topic for another day. But I guess the gruesome part, the sawing of the bones, that was done by a robot with incredible precision that probably no human hand could do. Where do you see it going in or maybe it's already being deployed in your field?
It is. Well, spine surgery is using a lot of robots now. And I think that's their biggest benefit right now is just those, the precision of the placement of a screw, the precision of the orientation and so forth, making that perfect. So that's better than what a human eye can do. But all the rest of the judgment that takes place in surgery, all the rest of the pivoting, what if this takes place, and what if the anatomy is just a little bit different than the standard and so forth, it seems that you need a human brain to be in there to guide that machine.
I can imagine that no two surgeries would ever really be the same.
That's correct.
Because you got thin people, you got fat people, you got young people, you got old people. I would think that, we know that the human body is changing on a daily basis.
Right.
So when you make that incision, do you know what you're getting into?
You know normals and you know the variations that you've seen.
You know what you expect.
That's right.
Right.
And you could figure it out from there. Yeah, every once in a while, the peripheral nerves in the limb aren't the way the book says, and they'll be branching off each other at a different location, and named nerves are not where they ought to be. It's rare, but it happens for sure.
So I think you're going to have a pretty good, long career ahead of you. I don't think that AI and robots are going to...
I'm not worried about it yet. You think about it
yet.
In radiology, though, or pathology. The AI's ability to interpret an image placed before it, I think, far exceeds humans. But you still need the human to take a look at that and say, I agree with that. Just like we said, you get misinformation as well.
Well,
I agree with that interpretation or not.
Anytime I go to a doctor and it's anything significant or major, I'm prone to get a second or third opinion.
Yeah.
So you don't have to go get a second opinion. You just look at it with our artificial intelligence, and that's your new colleague.
Right.
And that in effect is what Jensen, the CEO of NVIDIA, has said, that we're not going to replace jobs. We're just going to make people more productive and make them better informed on how to do and what to do in their jobs.
That's right.
So that may apply in your case as well. Are there things in your field that you can think of that relate to longevity? Are there things that we can do to take care of our brain and our spinal column and whatever makes up neuromedicine that will give us a better life in our later years? I don't know why I'm asking this question.
Sure. Well, you think about living well, it seems longevity in general is based on productivity and your sense of your value and contribution to the world. Oftentimes people retire and they don't live that much longer after they retire because they've lost their sense of purpose. Disabilities can contribute to your loss of sense of purpose. If you've had a stroke and you're requiring care around the clock and that sort of thing, you lose your sense of purpose, then your longevity is cut short. I think not taking advantage of the opportunities that are there, as we're talking about the reconstructive procedures, let's get you your function back. Let's give you a purpose. That's the whole goal of rehabilitation and reconstructive neurosurgery and so forth, is to get you to be able to get back engaged in your community, have a purpose, have a goal. And so once we achieve those goals, I think people are more likely to live longer and do well and flourish.
Dr. Justin Brown, he is a neurosurgeon who took valuable time out of his day to come and speak with us today on The Truth. And we're really grateful. I hope you'll come back.
Yes, sir.
And just keep us informed of changes and advances in your profession. We'd love to hear about them.
Will do.
Thank you. Have a great rest of your day.
Thanks so much. You too.